And I suppose it gets particularly disappointing when, you know, your team travels all the way to Las Vegas and can't get on top of the Bulldogs, mate. Hi everybody, it's Gerard and this is the State of the Union. Today I'm really happy that we've got the Honourable Ryan Park with us, Minister of Health, who's done incredibly good work over many years, and he is a good friend of our organisation. There's times that we rub up against each other, obviously, and that comes with the territory, but we've been lucky today to have a bit of time from Ryan, so welcome.
Thank you, Gerard.
This is probably one of the most important periods that I see that we're currently in at the moment. Whether it's, you know, cost of living or it's a range of things that pressure is on people, health underpins everything. Yeah. How are you feeling about it?
Yeah, massive, Gerard. When I get out and about and speak to healthcare workers and your members, cost of living comes up everywhere. It's a big issue. One of the reasons why I was really proud to work alongside you and your members around the salary sacrifice reforms is because they make a real difference. They make a tangible difference in people's lives, particularly for some of our lowest paid workers, but are critically important. When I speak to our cleaners, they often talk to me about that, and I remind them that sometimes they need to realise that no hospital opens up without a cleaner. It's that simple. Those types of reforms, whilst they may seem small, they may not get front pages, geez, they make a tangible difference. And the fact that the union advocated so hardly and strongly for a long period of time, that type of reform makes a difference, particularly for some of our lowest paid professionals in the system.
And you can see very clearly that health has got a lot of competing interests. You will never get to an end game. But when you look at things like the wages outcome for paramedics, which was outstanding, the extra paramedics, so to think that there's an extra 2,500 paramedics been put on, that's never happened before, particularly 500 in regional New South Wales.
Yeah, and Gerard, these things don't happen without advocates, and my mum and dad brought me up as a child to, if something's important to you, say it. If something's important to a lot of people, say it multiple times. And through your advocacy and through the membership, those reforms are making a difference. We've now allocated more than 250 paramedics to the bush, just to the bush, that would not have been allocated without that. Without professionally recognising paramedics and the work that they did, that wage offer wouldn't have been able to take place under the former government because of the wages cap. Those things in time, I know, will pay big dividends, not just to the individuals, but importantly for me, to broadly the community and to the health system. But something that you and I talk about, and people may not realise is we don't always just talk about industrial issues. We talk about reform, and we talk about how to improve the system and how your members can be engaged in that improvement. And that, from my perspective, is a real testimony to you and the team, because I think that advocacy makes a difference, not just to individuals, and that is important, but also to the system.
It is, and when you look at reform, the steps that you've taken, Northern Beaches Hospital. Last time we saw a buyback of a hospital was really, you know, sort of probably Port Macquarie. Yeah. This is outstanding, and bringing health into an area controlled by the government, not controlled by a competing interest who's driven by profit.
Yeah, it's a system that wasn't working. It was designed on a model where the private sector have a belief that they can do things a lot cheaper than the public. You know public health as well as anyone, Gerard. It's expensive business. It takes a lot of time, takes a lot of labour, takes a lot of intervention. We needed to get that hospital back. We think we can deliver a better quality service to the people of New South Wales, and in particular the people of Northern Beaches, and we can use that asset more broadly in the system. It's an important reform. We partnered with yourselves and others around making sure that governments in the future don't go down that path again, with essentially Joe's Law, all designed to try and make sure that there's a stopgap to stop future parliaments and governments exploring this type of model, because we don't believe it works. I'm yet to find an example where this is working to the benefit of the community, and it's not something that we're going to be supporting.
No, and because it always is the case that the government always maintains the risk, and a private organisation is there for their shareholders. So it can't be supplying all the services that you need when you've got to supply, you know, your profit margin at the same time.
Yeah, that's right. It's a challenge, you know, and public health is expensive to deliver. We understand that, you understand that, the community understands that, and with that there is a risk, and we have to make sure that we're balancing that investment, and we think this is a better model.
These reforms are occurring and they are coming, but they're all underpinned, aren't they, by the Special Commission of Inquiry, which, you know, to your credit, and this, you know, I'm not trying to sort of blow smoke, But the reality is that you stood up for that at the ALP conference 2 to 3 years ago now and had that argument, because if we don't understand the bottom line of where health expenditure is at the outset, how can we project the future? And that was just such a great outcome.
Yeah, Gerard, I think that will in time be one of the most important pieces of work we as a government do, because through your advocacy and the membership, it allowed us to pause after a period of great upheaval through COVID and have a real look at ourselves and whether we'll fit for purpose and how we can make ourselves fitter for the role that we do. It's unusual for a minister. It hasn't been basically done before for a minister to essentially ask for a special commission of inquiry, not as a result of a crisis, but just as a result of we want to make sure we're prepared going forward. And that's highlighted a range of things, statewide planning that the Secretary is really committed to doing, to make sure that we're having a look at the health budget in totality and we're planning resources and planning activities and planning services across the state in a more coordinated way. A focus on preventative care that I know you and your members talk to me about is a big part of the Special Commission of Inquiry, as is making sure that we've got a workforce that's sustainable going forwards as we cope with an increased demand of an ageing population and people turning up to our hospitals that are a lot sicker.
Yeah, and one of the important recommendations out of the Commission of Inquiry was to support the HSU's case on award reform. Yep. And we see, and I think you realise this as well, that we can't run health like it was back in the 1950s, 60s, 70s. We've got to be 2025 and beyond. And now that our cases are before the Commission, we can start to get to that point where we can attract, retain allied health professionals and paramedics who can be key to the future. Because my view is we can't rely on medicos consistently, particularly in regional areas. We have to do health a different way. Yeah,
without a doubt. Gerard, a couple of things. I remember you talking to me very, very early on around, I think it was 35 odd awards. We've been able to narrow that down. You talked to me about clauses in that award that were about work practices that don't even exist anymore. The Special Commission of Inquiry put a light on that. That allowed the government to work with you and your team to really focus on that award reform. We're certainly progressing that, and the Commission is certainly helping us. But what's spinning out of that, which is really important, is an idea around scope of practice, which is you've talked about and I've talked about a lot. We're still not utilising all of the skills of our highly trained professionals. Taxpayers rightly invest a lot in their training. What we want to make sure they're doing is they're working wherever possible to full scope. Because when a health professional is working at full scope, that means that we're probably delivering the care the most efficient and effective way as possible. When they're not, we're often seeing people move between one pillar and one post, and that's a challenge for them, it's a challenge for the system, it's a challenge for the health professional.
And you just sort of see allied health professionals can get people out of hospital and prevent them from coming back to hospital, taking pressure off that. And then also looking at paramedics now, their scope of practice is enormous and it's got a lot further to go. But they can be issuing people who are having a cardiac issue and maybe having an infarct at a point in time, antithrombolytic therapy at the scene, at the workplace, in your home. You can actually be in hospital within 15 to 20 minutes, already treated, not going to an ICU bed, not costing heaps of money in relation to ICU and then recovery because you've prevented the injury from escalating.
Yeah, the big reform piece for any government going forward is how do we keep people out of hospital? Not how do we get them in, it's how we keep them out. One of the best ways we can keep them out is have the intervention by highly trained professionals like paramedics who stopped being ambulance drivers many, many moons ago, now highly trained experts in emergency care, by having them partner with the health system to try and identify those patients before they go through those emergency doors or go through those hospitals is the best way of making sure that our hospitals remain what they're there for, and that is for acute patients dealing with life-threatening illnesses, and then as soon as they've got that care, we move them out and back into the community where they recover better and where their healthcare is delivered more effectively.
Which comes to the point of where society is now, and society clearly is becoming more hostile. We're seeing that play out in hospitals. Hospitals, in my view, are a microcosm of the community. So security within a hospital setting, and I always see security as part of the clinical function. Many people acting out in a hospital will be drug or alcohol related, mental health issues, anxiety because of a loved ones being treated in a hospital. So it is a real struggle, has been for a long, long time.
Yeah, well, we're exploring ways now with other ministers across the government on how we can strengthen the powers for our security guards to provide them with greater opportunity to manage risks as they're coming through the door. I don't accept that our staff should be punching bags, never have, never will. And whilst we've increased the number of security staff, we need to, as a system, have a look at the powers that sit around them, because, Gerard, you and I have talked about this before, but a patient presenting to an emergency department, say 20, 25 years ago under heroin overdose or impacted by heroin is very, very different to a person presenting with their methamphetamine or ice overdose. That changes the whole clinical nature of what is happening. It changes the environment in which they operate. It changes the safety upon which they operate. I think this is, from my perspective, top of mind in terms of how we go about doing this next. I think there's an opportunity, even in a trial setting, to really focus on a number of these areas where there's problems, having a look at the powers around it, have a look at the equipment around it, and see if we can get an actual best practice model, not only to keep your members safe, very important, but also to keep other staff safe, other patients safe, other visitors safe. These people can have an enormous impact on an environment, not just on an individual. And we can't continue to try and manage this in the same way that perhaps we managed people with a heroin overdose 25 years ago, when it's a very different drug with very different impacts on the person.
And I guess getting to the point also now of the award reform, that it's now playing out in real time. The government's reintroduced the Industrial Relations Commission in terms of our allied health professionals. We've been working on that for 2 years now. We've got dates now towards the end of this year to be heard. So it'll be 3 years in the whole exercise. What is the government's view that the Commission makes a determination, the government will then fund that determination?
That's right. Treasurer Mookie and the Premier have made it very clear that we, on behalf of working men and women, and through people like your advocacy, said the Commission needs to come back to help us work through these issues. What we've extended that to is also accepting the umpire's decision, and we've been very clear about that. I see the Commission the same way you do, as an opportunity to work through challenging problems. I don't see it as an obstacle. I also don't see it as the first place people should go either. I see it as an opportunity in the same way we did through paramedic reform, assisted and ably supported by a structure and a framework. And I think that's what the Commission provide, but the government's been very clear that we accept the umpire's decision.
Okay. And well, mate, just I guess on a personal note then, like this is probably the hardest gig I think in government. So how do you cope with that?
Yeah, it's challenging. I mean, pressure is privilege, and it's the greatest privilege of my life to not only represent working people in my own community where I'm from, but to shape one of the largest and most important functions of public office through the health system is a great privilege. But it can be very, very draining at times and can be very challenging. And what I try and do is make sure that every night I go to bed and just reflect on the day and think, what could I have done better? And get up next day and think, right out, let's go again. Let's try and do more today than what we did yesterday. And to do that, I try and exercise. I try and make sure that I do some meditation. I try and eat as well as I can, because this is a job that's 7 days a week, as the community would expect it is. That's the length and breadth of it, but it's a challenge. But I think from my perspective, the opportunity to work with people like yourself and working men and women and the people you represent and put around real change. I often say to people, I won't be a person in 10 years' time who goes to looks for plaques of my name on it. But what I want to do in 10 years' time is just reflect back and look at what improvements we made during our time to the system, what improvements we made for working men and women, and particularly what improvements have we made for people who don't always get recognised, people like our cleaners, people like our security staff. And for me, that's the real challenge, and that's why I love the job so much.
And I suppose it gets particularly disappointing when your team travels all the way to Las Vegas and can't get on top of the Bulldogs, mate.
Well, we were robbed about 5 or 6 times, Gerard, just so you know. Yes, I've spoken to the CEO of the Dragons. I made sure we put in a protest, but Yes, we'll get you one day, but
Yeah.
I'm not sure we'll get you this year.
Well, you know, if there's any consolation, I didn't think it was a stripper. Well, thanks so much,
Thank
mate.
you,
I really
Gerard.
appreciate
Thank
you
you for having
being
me.
here. And everybody, please feel free to give us your views in relation to these interviews. We want to be able to progress forward in a way that is going to be inclusive and answer the questions that you want. Anyway, thanks very much. We'll see you next time. Bye.